I'm here today with Dr. Mike Prebeg, chiropractor and founder of Skills in Hand. And today we're talking about his newest online program, FIFA, Foundations in Neurofunctional Assessment. So, Dr. Mike, why don't you tell me a little bit about you and your journey to becoming a practitioner?
Hello. I went to school in upstate New York. I had a background in science background in University of Waterloo. I really enjoyed the sciences, the biochemistry, the anatomy when I was going through school. Then I basically ended up in chiropractic college, New York Chiropractic College. And I enjoyed my time and my education there. But when I came out of there, I felt like there was something missing. And I took a lot of courses. I took active release techniques. I was teaching active release techniques. At that time, that was the premier soft tissue technique that was available for chiropractors. And they've done a lot for chiropractors. And then I was looking into acupuncture. I took a TCM acupuncture course. That didn't sit well with me. And then I ended up taking contemporary neurofunctional acupuncture at McMaster, and that was really where my eyes were opened, and I saw the way I wanted to practice and what I was looking for, and things started to move forward from there.
Awesome. That definitely sounds like an impressive journey and a lot of road bumps in the way, but seems like you've created a really great system now, which is what FIFA has developed into. So do you want to tell me a little bit more about what FIFA is and why you created it?
Well, the McMaster course, I stayed there. After I took it, and I started doing acupuncture, and I met some great mentors and colleagues there. I started to travel around with them, being exposed to elite athletes and very unique circumstances. And I kept on honing my skills during the time, watching them, and then opportunities did arise. But then as I was teaching, as I stayed along with the main course and continued to teach, over the years, I kept on noticing one very, very common trend. Everyone would learn techniques. Everyone would learn soft tissue techniques. Everyone learned acupuncture techniques. People were having a hard time. You'd come out of school with a very good, strong orthopedic assessment background, which is, again, that's one of the big things that bothered me in school. We'd have our orthopedic assessment, but the things that we're dealing with technically, if they're truly orthopedic, they should be dealt with the orthopedic surgeon per se.
Mm-hmm.
We're dealing with things that are more neurofunctional in nature. We originally called it functional, but it's actually neurofunctional because the nervous system is in charge of everything. So what happened is the common trend was people were having a hard time finding out what structures to treat and when. And then later on, when you had more elaborate treatment plans, where do we start? And I realized that over the time with my different mentors, I kind of created a systematic pattern that just made sense to me. And through that evolution, what I did is at one point I met someone. I basically stood there, talked about everything. He mapped it all out, put in a flow chart. And Mike, he said, you have a systematized assessment approach. And then that systematized assessment approach will give me consistent directionality during my treatment. And then so I'll have I'll know where to start, what kind of results I'm looking for, a full game plan. And then frankly, when I do my retests, if my predicted results are occurring, perfect. We move forward and keep going on with plan. If we don't get the predicted results, well, then we reassess and we look for deeper pathology. And it's been consistent. It's been very as consistent, but then also, like I said, consistent, but then also it's predictive in nature, the whole system. So that's where I found the value. And then I started to show people at the course the basics of the assessment method, and it really helped them. All of a sudden, right away when I saw them at the end of the course, we do a clinical outcome where they all treat outpatients. And the people that I've spent time with and showed them how to assess would all do dramatically better than the people that didn't have a good functional, because I got to say, because everyone knows how to assess, but they don't have a good neurofunctional assessment. And that's where that's how this course originated, and that's where it has evolved from.
Wow. Okay. Okay. So let's dive a little bit deeper. Tell me, so once they're enrolled in FIFA, what are they going to get out of it? How is it going to help them build their practice or have better assessments and be a better practitioner?
Well, that's a great question. One of the biggest problems I find with practitioners, especially new practitioners, but even practitioners all throughout your career, is getting your patients on a consistent treatment plan. One is to treat them during an injury. Everyone will come see you when they're in pain, but how do you show your patients that you can give a lot of value when they're not in pain? They're coming in feeling good. And frankly, that's where my whole business model is around performance. We call it performance protection, performance enhancement, performance optimization. I go and I see my elite clientele, like those are my A clients. They'll all see me on a regular maintenance basis. They've bought in, but it's not that they've bought in blindly. These are people that have been with me for years and years and years, and we've developed a relationship. So it's obviously, if they're paying me for that long, or if they're not, they're getting a lot of value from it, and they appreciate it. So that's one thing. I'm a very value oriented person. I want to make sure people feel the value, know the value of their time spent with me, whether it's in a course or whether it's as a patient. And FIFA, what I do is we show the patient, hey, this is your dysfunction. Hey, how do you feel after the treatment? Oh my God, that they could feel the difference. So they'll tell you that, like I said, when you sell a treatment plan to someone, they're like, okay, how often do I have to come? Well, my patients know. I asked them, how aggressive do you want to be? I want to fix this right away. Well, you could do it 2 times a week, or in my treatment model, it's a little aggressive. So we do 2 times a week as a max, more or less. It depends on your tissue level. If you're an elite athlete, you could do a little bit more, but 3 times a week, like once every week. It depends on what they want and what they need, but through the assessment process, we'll show them what they need. They'll understand what they'll need. They'll understand the benefits. They'll be asking to come back rather than you having to tell them when to come back. They'll be rebooking on their own, and that's the key, because that takes a lot of stress. Because you, like, when you're originally getting into practice, telling them a treatment plan without them understanding everything, it's very difficult. So that's
right.
What really crosses that bridge.
Okay, so it sounds like FIFA really helps you get your patients on board with their own treatment process. So it's a partnership rather than you pulling them along.
Exactly. I like to make sure the patients are involved in their treatment. It's not, I don't like guys that are, just dependent on you. You want them to be involved, understand. By people that I've been treating for years, they know muscles that a lot of doctors don't know. Muscles and nerves, and they'll tell you what hurts. It's almost annoying for me. Oh, Mike, this is tight, and this is causing this, and they'll tell you exact muscles and nerves. It's like you're like, you don't need me anymore.
Well, we know that's not true, but that sounds really beneficial, not only from the student's perspective, because they're getting pre and post roadmaps, if you will, but then also having that buy-in clinically from patients has to make their clinical outcomes so much more effective, right?
Oh, and their practices are more fun. you have a better relationship with your patients. So most doctors or manual medicine practitioners have great relationships anyway, but it just improves everything and it makes it more fun. I've actually, that was so rewarding. Um, I've had some course graduates say that, Mike, you've made practice fun for me. So, and that meant a lot. So that was a really cool outcome from the course.
Yeah, that's great. I mean, you don't want your practice to be a drag. So if you can help them make it more fun, I think that's a huge win. And then you also bring in other experts to help, not just you talking through your unique assessment model, but you also bring in other experts, right?
Yeah, I bring in I bring in a couple other experts, just more to show the continuum and the like. I bring in an orthopedic surgeon because what I want to prove to people is, you know, once an orthopedic surgeon does their thing, like you have to be different. So I wanted to, and frankly, also one of the take home messages from FIFA, there are a handful of orthopedic tests that you have to be really, really good at. There's things that you can't miss that practitioners miss all the time. And people that spend time with me will know those key things that, you know, because you want to look good with your other healthcare providers.
Mm-hmm.
I bring in an elite strength coach just to show from injury to high performance, there's a whole continuum that's available for us. So frankly, there's so much opportunity for the manual medicine practitioner. And that's really, you know, the foundations of FIFA will allow you anywhere in that spectrum. All like it's actually utilized by the orthopedic surgeon and the strength coach, and then you're going to be the master of it in that middle part of the spectrum.
Okay, so it doesn't matter if you're just starting out or you've got an established practice, it's going to help you up your game and maybe even move into more elite treatments, it sounds like.
Yeah, it clarifies things. It does. It just opens up. You just start treating a little like people that have been in practice for a long time. It's a little different because they're you know, they have their own set ways, but it's very, very moldable, adaptable, easy to implement. It's implementable into anybody's practice, and people do find benefits. But it's the thing is, it's also you could be a medical doctor, you could be a athletic therapist, a massage therapist, a physiotherapist, a chiropractor. There's there's some strength coaches that utilize some of the principles because it helps them do a global assessment, and then it helps organize their strength and conditioning programs. But it just helps understand your patient's or your client's body that little bit more, give you some red flags, give you some areas to address, and then you can address them with the techniques or the modalities that you utilize. I personally have my preference, and my expertise lies in acupuncture and in soft tissue treatments and joint mobilization. Those are technically the primary three modalities that I use. But you know, other people can use exercise-based interventions. They can use different modalities as shockwave, percussor, laser. So there are different things that you could use, but I have my key go-to tools.
Right on, right on. Well, it sounds like it's a valuable tool to have in any sort of arsenal that you already have in terms of treatment. So before we wrap up here in a couple of minutes, can you give me a couple bullet points of what the students who sign up for FIFA are going to get from FIFA where they might not get it from anywhere else?
Yeah, you're throwing me okay, that's a good question. Like, so people will get a step-by-step process that they really will have a good functional understanding. We're going to take you away from the orthopedic tests that you're continually are taught. You're going to understand where to treat, why you're treating there, and you're going to have an outcome measure. So you're going to do a pre-test, post-test. Those are very, very important principles. And you're going to have And you're going to improve your body mechanics a lot, because actually that's something that's very undervalued. Because I've treated, and I could treat from 8 a.m. to 8 p.m. straight, and people are like, "How don't you get tired?" Well, the way I utilize my global body, I actually protect my energy. So we do show little nuances of that in FIFA, because body mechanics are paramount in testing. And if you don't have good body mechanics, all the best therapists know how to utilize their body and get themselves in good positions, so that they're not really muscling techniques. Because as soon as you muscle something, you won't get a good evaluation. So that whether we don't really verbally say it or you'll see a lot of it, and we're actually subliminally implanting good body mechanics through the whole program. You're going to improve your body mechanics, improve your functional assessment, better directionality with your treatment, and better outcomes.
Awesome. All right. Well, this sounds like a phenomenal program, and I think it's great that it's something that they can do at their own pace, so they can brush up on skills and do it over the weekend if they want. So your students can learn more about FIFA in the following link, but I just wanted to say thanks for joining me, telling me a little bit more about FIFA, and have a great day.
Thank you so much. We finally got some sun, so we'll enjoy it.